Hi, Dr. Regina Rodman here, and today we are going to talk about the risks of a facelift. So first, what is a facelift, what is a neck lift, and what's the difference? People really use those terms interchangeably. So a facelift, what that really means is a lower facelift. So a facelift generally addresses the jawline, the jowls, and the neck. There are some extended facelifts, which may also help with the cheeks, but generally that's called a mid facelift. The brows and everything in the upper face generally is treated with a brow lift. So when we're talking about facelifts, usually we're talking primarily about lower face and neck. So I've had patients say, well, I only want a neck lift, I don't want a facelift. If you just think about that, you can't pull the neck tight and then leave everything in the lower face still droopy. So what we're doing in pretty much every lift is addressing all of this area. So facelift, neck lift, I don't know that the semantics really matter. Making sure that you're addressing the area that is your area of concern is probably more important. So risks that go with a facelift. So the facelift is actually a pretty big operation. Can be done different ways. I do mine in the operating room. It can be done with sedation or general anesthesia, just kind of depending on the patient and what risk factors they have, health factors that they have, and patient preference. But generally I do it in the operating room. I just feel like I get a better result than trying to do it in the office, or at least with the setup that I have in the office. So what a facelift involves is an incision that is either in front of the hair or here in the hair, goes along the front of the ear, actually goes into the ear, down behind the ear, back up, and then into the hair a little bit. It's a very big incision. The good news is these incisions heal very, very well. So even within a month, they are barely visible. By a year, I really have to squint to see where the incision was. The way that I do it, I usually pull it behind the tragus of the ear and then down around the earlobe. So unless it's your hairdresser or someone that's really, really looking close, people will not be able to see it even with your hair up. So the incisions heal really well, but it also means that the patient has to do their part and take care of those incisions, keep them clean, keep them moisturized, and then ideally after the sutures are out, put scar gel and sunscreen on them every day so that they heal as well as possible. Other risks with facelift, the other probably biggest risk, or the thing that happens most commonly, still uncommon, still in probably less than 5% of patients, but the thing that I have seen happen both in myself and in my colleagues is what's called a hematoma or a bleed. The face is super vascular, there's tons of blood vessels. We elevate a pretty big flap of skin with a facelift, and so there's a ton of little blood vessels all under there. There is a risk that one of those little blood vessels opens up and bleeds. If so, it can collect blood under the skin. That is something that your doctor needs to know about right away, because we generally like to make sure that we dry up that blood vessel and drain any of that blood right away so that it doesn't create a problem with healing. Same thing can happen with just a little bit of fluid, like serous fluid. That usually happens much more slowly and is easy to drain in the clinic if that does happen, but still something your surgeon needs to know about because we don't want to impair healing. The scary thing, and so that's probably the most common thing, the scary thing that can happen is a little bruise to the nerve or an injury to the nerve, especially the one that moves your lower lip. So it runs right in this facelift area. It's generally in a different plane than the area that we are doing dissection, but there's always a risk that it gets stretched or that it gets just kind of bruised by a little bit of cautery. If that happens, you may notice a little asymmetry of the lips. It can also happen, there's another branch that innervates the muscles of the neck. These muscles of the neck in some people also have a lot to do with how the lip moves. And so if that nerve gets damaged, which it almost always does get at least bruised from the neck lift, in some patients, it will make a difference in how the lower lip moves. Now, I have always seen this be temporary. The nerve is usually not cut, it's just kind of bruised, and in protest, it doesn't work as well. But what happens is that patients will notice a little bit of an asymmetry in their lower lip when they smile, usually temporary, but it can take weeks, sometimes even months for it to completely resolve. A little bruise to the nerve can also happen in the nerve that goes to the mouth, the nerve that goes to the forehead. I personally have not seen these happen, but I have heard of these complications happening. So it is possible, although rare. Other thing that can happen, the salivary gland, the parotid gland is right here. It also goes way back here behind the ear in some patients to an area where we do a big part of the facelift. If a little bit of that gland gets damaged, it's possible for saliva to collect under the skin. Patients will usually notice this a few days post-op or a day post-op. When they eat, they notice a little bit of swelling somewhere in this area. If that happens, it does eventually go away. It does burn out. A lot of times what can be done is inject a little bit of Botox. Actually, Botox quiets down the salivary glands and makes it produce less saliva if there's like one focal area where that's happening. Again, this is rare, but these are things to know ahead of time. There can be a risk of hair loss. The incision here goes up into the hair, or sometimes it goes in front of the hair, just kind of depending on patient preference and surgeon preference. There is a risk of hair loss there or behind the ear where the scar is. Now, what we try to do is take the tension off those areas so that there's not a lot of pull on those areas and that it heals well, but there's always a small but real risk of having hair loss around there. The other risk, that's another kind of big scary thing that's rare but does happen, is that there can be a problem healing where the skin in the area, what we call the flap, the facelift flap, that skin just doesn't have enough blood supply after being elevated and it doesn't heal as well as we want it to. This can look really terrible and really scary as it's happening. It generally does resolve pretty well. We have started using hyperbaric oxygen. I have a tank actually in my office. So facelift patients will go before and after, multiple times after surgery, to help oxygenate the blood and help with revascularization. So one of the things we do if this does happen is hyperbaric oxygen. We're doing it prophylactically as well, but hyperbaric oxygen wound care generally will restore some of the blood flow and it heals. There's always a risk that the scar still doesn't heal as well as we want. Usually what we would do in that case is let it heal, kind of let everything settle, and then it's possible to do a scar revision later. So with a lot of these things with a facelift, it's suboptimal, but it can be fixed. It's just important to know that these things can happen and to be prepared if it does. Other risks, change in the skin sensation, almost 100% guarantee it's going to feel weird. Your earlobes may feel numb temporarily. The cheeks are going to feel a little bit numb temporarily. That's normal. There can also be a little bit of asymmetry. Again, I've talked about this before, like almost everyone has asymmetry in the face. So one side of the face is always a little bigger, a little bit better developed than the other side. This happens in everybody. What that means is then when we redrape the skin and we're able to see the bones and the definition in the face, you may actually just be seeing some asymmetry that was there before. You may be seeing it a little bit more clearly. But it also can happen that one side just heals a little differently or one side stays swollen a little bit longer. The name of the game with that is really just to be patient and wait and see how everything settles finally. We also list a bunch more risks, but that are really, really, really rare. So these are the ones that are most common. And like I said, even then, that doesn't mean that they're common. They're still a fraction of a percent, but they're important things to know about when you're making your decision.